Injustice anywhere is a threat to justice everywhere.
This is the year almost 2020, and we should not have these types of health disparities in the year 2020.
And about this issue, my father passed away from colon cancer.
I've lost loved ones to tobacco-related illnesses.
We know the Tuskegee Institute story like the back of our hands.
Buffalo is in the midst of a renaissance, from downtown to Amherst, from the waterfront to Cheektowaga. But east of Main Street, Buffalo's African American community is slowly dying. The mission of the African American Task Force on Healthcare Disparity is to eliminate race and ethnicity-based health disparities among communities of color in the greater Buffalo region. This task force was formed for the specific purpose of changing public policy that impacts health outcomes.
When you start peeling it back and you ask a room full of people in a neighborhood, how many of you have hypertension, and there's 90 people in the room, and 87 of them raise their hands in the same neighborhood, you have to say, what is going on?
Where you live plays a key role in your longevity, according to a 2015 report conducted by the Healthcare Disparity Task Force.
We've been working since about 2014, looking at the conditions, the health outcomes of African Americans who live in 5 zip codes in the city of Buffalo or in Erie County. So about 80% of African Americans kind of live in these 5 or 6 zip codes. And what we learned from looking at the data, the county data, state health department numbers, is that African Americans who live in these communities are 300% more likely to have chronic diseases, hypertension, diabetes, cancers, than whites who live outside of those districts or of those communities.
Many factors combine together to affect the health of individuals and communities. They are called the social determinants of health. Health and healthcare, economic stability, poverty, employment, educational attainment, neighborhood and the built environment, social and community context, community perception. The data exists. It says Erie County has one of the worst health disparities in New York State. The key to addressing health disparities in the African American community will take a comprehensive approach involving dedicated partners now at the table, partners with bold ideas.
The solution to this is really going back to what we used to do as a country doc, with maybe through a telesystem, telehealth. So we're taking care of people in their homes, looking at the environment they're with, and really getting the medications, getting them to do what they need to do.
People are suffering in the community, and we have expertise and strategies that may be helpful to address those underlying social determinants of health.
ECMC sits in 14215, which out of all the zip codes has some of the highest prevalence of disease. So I think it's the time is right for healthcare institutions and the community to come together to look at social determinants of health.
Our focus really is to help not only educate the community, but also to work with the practices and the medical and behavioral health community to help link those patients to their services.
So what's going to make this process unique? It's the power of collaboration, right? It's the power of partnership. It's the power of unity, right? So creating a table where we have healthcare professionals, business leaders, environmentalists, so that the quality of their life will be better, their lives will be longer, and it just makes so much sense.
One of the things that, I believe Martin Luther King said that we may not remember the words of our enemies, but we will remember the silence of our friends. So therefore, we're hoping that we provide the community with a platform to really exercise their voice, to ignite hope, and for others to take action, to get involved, and to be a part of the movement.